In 2017, the Center for Health Law and Policy Innovation of Harvard Law School and the Boston-based nonprofit Community Servings came together to launch the Massachusetts Food is Medicine State Plan. Convening over 30 stakeholders from across the Commonwealth, they began to gather data on the burden of diet-related illness throughout Massachusetts and on the innovative nutrition interventions to begin to mitigate this epidemic of chronic disease.
1 in 10 people in Massachusetts are food insecure. But at some of our health centers that we're doing screenings with, we're seeing nearly 6 times the state level. Food insecurity has been associated with poor overall health, less nutritious diets, and also mental health.
As healthcare providers recognize that food and health are inextricably linked, the view of how best to model a healthcare delivery system is changing.
We are entering a moment of transformation here in terms of our healthcare delivery system. We're moving towards value-based payments and pay for performance. All of these recognize that we want to pay for and support health programs that meet the triple aim of healthcare reform. Those are programs that improve individual health outcomes, increase patient satisfaction, and ultimately reduce cost. What's so incredible is that Food as Medicine meets all of those goals.
Food as Medicine interventions provide healthy food for people who are at risk for or have a health challenge like obesity, diabetes, or heart disease, which can result in them becoming super utilizers in the healthcare system.
As a physician in the emergency department, when I encounter patients, I always ask them, what would it take for this to never happen again? And then you begin to understand where things like food may come into play. If you don't have money for food or money to pay your utilities or whatever, healthcare is the last thing you're going to be focusing on.
Food as Medicine is about equity. Ultimately, the state plan is about developing a roadmap so that over time we can be sure to have food as medicine interventions throughout the Commonwealth and to meet the needs of all of our communities.
These interventions could be as simple as a voucher for fresh fruits or vegetables for someone with cardiovascular disease or diabetes. For those who have complex or advanced illnesses, the most appropriate service for them might be home-delivered, medically tailored meals, like the ones that Boston-based Community Servings provides.
What we look for is the person who is not only hungry and perhaps living in poverty, but more importantly, unable to walk to the store, unable to shop and cook, and most importantly, unable to understand very complex medical diets. Community Servings is partnering with researchers at Mass General Hospital to look at the insurance claims data for patients that we've been feeding over the past 5 years. It's an incredibly exciting study looking at the costs of patients we've fed versus patients we haven't fed with similar backgrounds. What we see is a significant savings in those most expensive services, ambulance usage, ER visits, and inpatient hospitalizations.
This research showed a 16% net reduction in healthcare spending for patients who received medically tailored meals.
When I was diagnosed with diabetes, it was like a punch in the stomach. My whole world changed. Everything had to change. It takes a lot of stress off to know that you don't have to worry about where is your next meal coming from. You know that there's one coming and it's good for you. And that's huge. That's really huge.
At Boston Medical Center's Preventive Food Pantry, patients receive healthy food assistance for themselves and their families.
This food pantry started 16 years ago. It's a prescription-based food pantry. Patients get screened for food insecurity at the clinics, the primary care clinics, and if they're eligible, they get a referral to come to the food pantry. That's important for us because we need to know what type of diets these patients are on. So based on their dietary restrictions and the number of people in their household, we set up carts for them. We provide food for the whole family.
It helps me. They help me to feed myself. It has not been that easy. Things are so hard outside. But with what they are giving me, I use it to substitute to feed my family. They are so good.
The Food is Medicine model responds to rising rates of diet-related illness and the emerging research that associates the risk for these illnesses with food insecurity. In fact, a recent study found that food insecurity cost the Commonwealth $2.4 billion in 2016 alone.
And knowing that most of those health episodes are controlled by what we eat, which is a lower cost than showing up in an emergency room or getting on expensive medication, we're very interested and very supportive of trying to improve access to better quality of foods in many of the communities in which we serve.
The goal here is to understand what food as medicine interventions currently exist, making sure that we have a complete inventory of the programs that we already have. But at the same time, and as important, we're really looking to understand where capacity exists and the capacity to create new food as medicine interventions in the Commonwealth.
The Massachusetts Food is Medicine State Plan, because food is medicine. For more information, visit our website.